NWPB here with a sneak peek of an upcoming community spotlight. This time we're going inside Sign Fracture Care International. It's a Tri-Cities-based nonprofit making a huge impact.
Our mission is to provide U.S.-level orthopedic care to the poorest patients in what's called lower and middle income countries, used to be called developing countries. We've been doing that successfully for 25 years now. We've treated close to 440,000 patients. We should make 450 by the end of this year. We've done it with very dedicated people here at Sign.
These are patients that have been injured in typically road traffic accidents. So maybe they're a pedestrian, a bicycle rider, or a motorcycle rider, and they've they break their femur or tibia, so both of your leg bones, or humerus. And so we provide implants for the surgeons to treat those patients, orthopedic trauma patients.
Yeah. What's the outcome otherwise if they didn't have tools such as these?
Well, one, they can't afford. A lot of the patients cannot afford the surgery or the implant. And so they would just be probably crippled, right? So they would go on to heal, maybe not naturally, but then they would be disabled. Together,
we've been able to use our unique skills, each of us, to help surgeons in developing countries, equip them with the right kind of implants and the right kind of education to be able to treat patients the day they arrive in their hospital. A friend of ours, Dr. Baruch from Ethiopia, is going to talk to you about what an impact we had in Ethiopia. But that impact, it was called disruptive technology, that we brought this sign nail to these countries that had nothing, and patients can't afford to buy it, so we give it for free, and give them the training for free. And then they might have, the day before we gave it to them, been thinking about moving to another country or going into a different profession because their hospital couldn't afford to buy the products they needed to treat their patients. They were no better than what's called a bone setter. A bone setter just brings in a patient, puts on salve or cast or something, and the patient stays in their sort of hospital for months and then comes out unrepaired, incomplete as a person. And these doctors are now able to, every day, save limbs and then save lives.
Stay tuned here and find us online at nwpb.org, on YouTube, Instagram, and Facebook for that full story coming soon.